Man, Sonic is really good. And this cherry limeade is especially good.
You know, speaking of limes, we were talking about Lyme disease in class last week.
Wait, can I get Lyme disease from this?
No, it's L-Y, not L-I.
Okay.
But you can get it from tick bites.
Are there ticks in this?
No!
That's a good thing.
I hope you all enjoyed that short introduction to Lyme disease. My name is Molly Fortner, and I'm a graduate nursing student at Auburn University, and today I'm going to be talking about Lyme disease. Lyme disease is a multi-system inflammatory disease from a tick-borne bacteria. The incubation period is 7 to 10 days, and ticks are most active from May to September, meaning this is the time frame we will see the most Lyme disease. Not all ticks are infected. The black-legged or deer tick in the eastern part of the United States is the most common. The tick must be attached for 24 to 48 hours or more before the bacteria can be transmitted. Lyme disease does not spread from one person to another, and the transfer of bacteria from an infected pregnant woman to a fetus is extremely rare. Lyme's got its name from a town in Connecticut named Old Lyme, where it was isolated in residence in the 1970s. What puts people at risk? Exposure to tick-infected areas, grassy or wooded areas, and hunters because they're around the deer that carry the ticks. Lyme disease has no regard to race and gender. Essential questions you should ask your patient. Have you been in any grassy or wooded areas within the past few days? This would create an exposure to ticks, putting the patient at potential risk for Lyme disease. Have you had any flu-like symptoms such as fever, chills, and myalgia? Many times, people with Lyme disease come in with flu-like symptoms. Have you had a rash that grew to resemble a bullseye? Does the rash itch? Does the rash burn? Is the rash greater than 5 centimeters in size? The bullseye rash is the most common sign of Lyme disease, and the last 3 questions further confirm a true bullseye rash. Your physical exam. Your physical exam would start with dermatological. The bullseye rash, like I said before, it's pictured on the right, is the most common. It is a local inflammatory response, and 70 to 80% of all Lyme disease have the rash. The severity of infection is dependent upon the amount of time the tick has been feeding on the host. So you can have fever, chills, headache, fatigue, stiff neck, muscle and or joint pain, and swollen glands. As the disease progresses, you could see severe fatigue, a stiff aching neck, and tingling or numbness in the arms and legs, or facial paralysis can occur. Most severe symptoms can include severe headaches, painful arthritis, swelling of joints, and heart and central nervous system problems. The differential diagnoses you would want to rule out are viral syndromes, Rocky Mountain spotted fever, and relapsing fever. Your treatment. Your first line of treatment is doxycycline 100 milligrams twice a day. If it is an early localized symptoms, you would do it for 10 to 14 days, and if it became systemic, you would prescribe for 30 days. The alternative agents are amoxicillin and Ceftin. And doxycycline is contraindicated in children and women who are pregnant or breastfeeding, so you would want to use an alternative agent for these patients. The outcomes. Early treatment of Lyme disease involves antibiotics and almost always results in a full cure. However, the chances of a complete cure decrease if treatment is delayed. Headache, fatigue, and malaise commonly take months or years to resolve following treatment. And finally, your patient education. You want to start with instructing the patients to protect against tick exposure, avoid foliage, wear pants and tuck them into boots, stay in the middle of a wooded path. Next, inspect. After removing clothing, inspect the axilla, groin, and waistband area for evidence of attached tick bites. If you find a tick, remove it immediately with tweezers, not your fingers, and do not put alcohol, nail polish remover, or anything else on top of it. And if you know you're going to be in a grassy or wooded area, use insect repellents with 20 to 30% DEET. And finally, you want to educate the patient on the antibiotic therapy that you put them on. For instance, if you put them on doxycycline, make sure that they know to finish the entire course, wear sunscreen to avoid photosensitivity reaction, and use a non-hormonal method of contraception until their next menstrual period. These are my references, and I hope that you learned something from this 5-minute video on Lyme disease, and thanks for watching.